Now look at this neck carefully. What do you see? This patient has a scar on the neck. This is a scar of thyroidectomy. This patient presented to us after thyroidectomy with certain symptoms, and on examination you can see the Shostak sign when you tap on the cheeks where the nerves, the branches of the facial nerve are passing. This results in twitching of the facial muscles, and a similar sign can be aroused in the upper limb. This is called Trousier sign. When you inflate the blood pressure cuff in the arm and create an ischemia, there is a specific posture is made by the fingers. The fingers tend to flex and they assume a posture which is called obstetrician's hand. And this patient had, when we examined, a calcium level of 6.1 milligram per deciliter for an albumin of 4.1 gram per deciliter. So this patient had presented with hypocalcemia, the symptoms of hypocalcemia. It was because of the injury to parathyroid glands during the thyroid surgery. Now, how do the patients with hypocalcemia they present? You see, they may have numbness, tingling, and muscle cramps. These are the neuromuscular symptoms. Patient may have wheezing, dysphagia, and voice changes if there is involvement of the vocal cord or the larynx. This is the most serious problem because it can interfere with the respiration of the patient. Then patient can have psychological symptoms like irritability, depression, fatigue. And you see, if the patients have chronic hypocalcemia, they can have coarse hair, brittle nail, dry skin, they may have pruritus, there may be poor dentition, and there may be cataract as well. Now, what are the causes of hypocalcemia? The most common is vitamin D deficiency, which is generally nutritional. It may be malabsorption, or it may be because of the kidney disease, and sometimes it's not. Vitamin D's deficiency is because of poor exposure to the sunlight. And then patient can have true or pseudo hypoparathyroidism resulting in hypocalcemia, and then patient may have hypomagnesemia, alcoholism causing hypocalcemia. There may be drugs, sepsis, massive transfusion. They can produce hypocalcemia. Conditions like rhabdomyolysis and acute pancreatitis, which can bind the calcium, resulting in hypocalcemia. Now, how we investigate patients who got hypocalcemia? We go for ionized calcium, we go for phosphate, intact PTH, renal function test, vitamin D2 levels, magnesium, and albumin. So these are various tests which may be required in patients who got hypocalcemia. Now, how we treat? We replace oral calcium. We should give calcitriol. Why not calcidiol? Because the conversion of calcidiol into calcitriol requires PTH. If PTH is absent, the calcidiol is not converted into calcitriol. So that's why in patients who got PTH deficiency, they should be given calcitriol. Other patients can be given the D2 vitamin D. And some of the patients who are resistant may require recombinant PTH for the treatment of resistant hypocalcemia. So this is in brief, what is hypocalcemia, how does it present, how do we investigate, and what are the treatment options.